Good evening, everyone, and welcome to this incredible evening with a group of brilliant friends and great community leaders. My name is Barbara Fernandez. I have the honor to be the chair of the Latino Endowment Fund, and I want to welcome you to this great event. The Latino Endowment Fund, since 2003, has granted over $150,000 to community organizations throughout Connecticut, throughout Greater Hartford, excuse me, and our fund is almost $500,000 right now. I just want to say a couple of words and then turn it over to my mentor, my friend, who is going to be the moderator. All of us, those last couple of years, have been through hell. There's just no other word for it. Personally, professionally, COVID has really devastated many families, but especially the Latino community. These are things that we have faced before, but somehow COVID-19 was a harder blow than anything else. And I think part of that is because the Latino community was already challenged, was already struggling. And so COVID-19 added an additional spotlight and added an additional burden to a community that, though vibrant and strong, still had many, many challenges. And one of the things that you will see today from our panelists and our great speakers and our partners from the Hispanic Federation is that we have a lot of data, we have a lot of ideas, but the thing that we have that joins us, that joins all of us, is our determination not to go back to what is called normal. Because COVID-19 has shown us that normal is not good enough for the Latino community. We are going forward and we're going to be stronger, stronger than ever. I am confident that we as a community are going to show the world how to not only survive COVID-19, but how to thrive and how to be better on the other side. And so with those opening words, I now want to turn it over to my friend, my mentor, my hero, can I say, who has been with me every step of the way. A person that does not need any introduction is the great Rosaida Morales Rosario. Thank you.
You left me speechless, Barbara. Okay. Can you guys hear me?
Yes.
Okay, wonderful. I keep getting these unmute yourself type of things. So welcome, ladies and gentlemen, bienvenidos. I am very excited about tonight's program. We're going to hear from two fabulous people on as keynote presenters on the topic of overcoming COVID-19, economic barriers for Latino community, a topic that should be near and dear to every one of our hearts, because our community has in fact been devastated by this horrible, horrible pandemic. Following the keynote presentation, we will have three fabulous panelists, and I am going to be giving you a lot more background on them when we get to their presentations, but they will be looking at this, topic of overcoming COVID-19 economic barriers for the Latino community from the perspective of health, small business, and education. And then we'll have an opportunity to have some questions and answers, hopefully, from the audience that we'll ask you to put in the chat room when we, as we go along, and we'll be looking at those questions and bringing them up during the Q&A. Once we finish with the Q&A, we will go into our breakout rooms because we want you to have an opportunity to talk and discuss further about what you've heard, about what you've learned, and quite frankly, to share with us about what you think you would be willing to join with the Latino Endowment Fund in trying to find some solutions on. We will hear a little bit from the breakout rooms after that, and then our Vice Chair, Delpha DiGiacomo will have a summary of today's proceedings, and we will close it with the wonderful president of the Hartford Foundation for Public Giving, Jay Williams. So without any further ado, I want to introduce to you our keynote speakers and presenters. The first person I'm going to talk about is a dear friend of mine. I knew her when she first started in her role with the Hispanic Federation, and she has grown immensely in that role. She is now the Vice President for Policy and Strategic Engagement, and that is my friend, Ingrid Alvarez de Marzo. In addition to Ingrid, we also have with us today her colleague, who is Diana Caba, and she is the Assistant Vice President, so she is her right-hand person at the Hispanic Federation. And she has come to the Federation having served as the Senior Director of Economic Empowerment before, over the programmatic and advocacy efforts. She was also the founding program director of the Northern Manhattan Arts Alliance. I give you my two colleagues, Ingrid Alvarez de Marzo and Diana Caba.
Gracias, Rosaida, and good evening. Bienvenidos a todos. I am Ingrid Alvarez. I am the Vice President for Policy and Strategic Engagement at Hispanic Federation. I'd like to start off with deseándole a cada uno de ustedes un feliz mes de la herencia hispana. Happy Hispanic Heritage Month. Welcome and thank you to everyone joining the Latino Endowment Fund and Hispanic Federation this evening for this important conversation about the economic impact of COVID-19 on our Latino and immigrant communities. We will have a chance to hear directly from some of our strongest community champions and thought leaders who are fighting to ensure that the voices of our people are heard, as well as my colleagues here at the Hispanic Federation, who you work alongside with to advocate at the local, state, and national levels to uplift and care for our community, especially in times of crisis. We come together today, yes, to underscore the devastating impact that COVID-19 has had on our community, but much more so to break bread virtually about solutions about how we move forward towards a better future for all people. While the recently passed American Rescue Plan gives us hope and something tangible to build from, it provides a lifeline for millions of Latinos and other Americans, ensuring that they can keep their jobs, incomes, and their homes, enabling parents to support and feed their families. It provides much needed childcare, emergency rental assistance, state relief aid, and monthly cash payments for low-income parents. Just the child tax credit alone will largely be responsible for cutting the child poverty rate in half over this year. It is, in short, the most progressive piece of legislation we've experienced in generations. But obviously, one bill alone is not enough. And that is why we must ensure that critical provisions in this bill become permanent, as well as the Build Back Better agenda, which includes the American Families Plan, and key elements of the American Jobs Plan that were not included in the Bipartisan Infrastructure and Investment Act, also known as reconciliation. And it is up to us to make sure that our members of Congress and the administration make that happen and pass other much needed bold and progressive bills that will address the historical and systemic inequities that COVID-19 has exacerbated and laid to bear. Our work is far from over. We must continue to speak up, to take action, to let our elected representatives right here at home and beyond know not only what we need, but what we expect. We look forward to being with each of you in this fight. We know that if we do this together, our communities will win, and our country and our state will be better and stronger for it. Without further ado, I have the distinct honor of introducing my co-presenter for this evening, Diana Caba, AVP for Policy at the Hispanic Federation. And together we will share with you overcoming COVID-19 economic barriers for Latino communities, Welcome, Diana.
Thank you, Ingrid, and thank you everyone at the Hartford Foundation and the Latino Endowment Fund for this invitation. During this presentation, we will share our report, Overcoming COVID-19 Economic Barriers for Latino Communities. With this report, we use the collective wisdom of Connecticut Latino civic leaders, business owners, nonprofits, and individuals, and we lay out a series of specific policies that can help our communities recover. These are proposals that emerge from the people and institutions that know our community best. Implementing these policies will require a commitment by our political leaders and our own steady assistance that ours is a community worth fighting for. That rebuilding our community is the surest way to rebuild the nation. As Latinos and other United States residents collectively battle the coronavirus, Hispanic Federation and New America aimed to identify gaps in data and information to help the community with this existential challenge. Communities and nonprofits, philanthropists, and local governments that serve them urgently need assistance to access and interpret data for decision-making. They also need help in informing the public about the patterns of COVID-19 infection and the community response is needed to fill these gaps and ensure informed decision-making in response and recovery. And don't mind me as I try to manage. I see that it's not responding to my changing the screen. Can you give me one moment? I'll make sure that I can access the PowerPoint. Okay, here we go. Apologies for that technical moment there. So yes, so with our new report, we aim to accomplish 4 broad goals. One is to use data to strengthen the evidence base for how conditions impact the livelihood and well-being of Latinos, ensure that community participatory research produces data that can be communicated in ways that change how audiences perceive the Latino community and how our issues are addressed, build the capacity of local people to use data to promote community leadership and make informed decisions about issues that impact them, and develop norms for how data should be created and used to ensure equity and inclusion. The report combines information and statistics from respected national, state, and local sources with key findings from a 3-part data collection effort. It focuses on how the COVID-19 pandemic has affected Latinos in 3 critical aspects of life: work, food, and shelter, and recommends actions to help Latino communities survive and recover from the pandemic, offering recommendations by issues. In addition, it identifies needs for cross-cutting actions that affect as many aspects of life. At the end of 2020, we at the Hispanic Federation, in consultation with New America, launched a community-driven research to better understand how the COVID-19 pandemic has impacted Latino communities in Connecticut, Florida, Illinois, New Jersey, New York, and Puerto Rico. Through these community surveys and focus groups, we learned about about how the pandemic has impacted Latinos and the ability to work and or access assistance for basic needs like food and shelter. The findings have been collected and presented in this report and is intended, again, to help decision makers better develop programs and policies that serve the need of Latino communities. So as I mentioned before, in early October 2020, we launched our community survey to capture the experience of Latinos that were impacted across the states mentioned. It was a 12-minute survey disseminated in the 6 targeted states and regions and was completed by 2,906 community members, 2/3 of which responded in Spanish and 1/3 responded in English. In addition to distributing the survey among Hispanic Federation's network of advocates, member agencies, and partners, we also promoted it through targeted social media ads. Individuals who completed the survey could enter a drawing for a $250 gift card. Of those survey takers who partook in the drawing, 20 participants were selected to receive gift cards via certified mail. In late October, to identify where and how small businesses have been most affected by the crisis, particularly in areas where people with low incomes and communities of color live and work, the Hispanic Federation disseminated a 7-minute survey to over 1,000 businesses, small businesses in the targeted geographic areas. We received responses from 93 businesses, 97% of them Latino owned, and gained insight on businesses involving needs during the pandemic. And as you can see here, we had quite an extensive list of community organizations, community leaders from all of these organizations participate in focus groups in November 2020. So we conducted 7 focus groups with nearly 90 Latino nonprofit professionals and community advocates, serving communities of color in all the mentioned areas, specifically New York City, New York State. So this included upstate regions in Long Island, New Jersey, Connecticut, Florida, Illinois, and Puerto Rico. Top line community survey findings and state-specific results were shared with each focus group. Following this overview, we then led 3 rounds of breakout brainstorming sessions to help participants identify best programmatic practices regarding food and shelter supports, income and small business supports, and recommendations for systemic changes and policy solutions. So using these insights from our focus group participants, we then were able to compose recovery strategies that will enable organizations, philanthropists, and policymakers to develop, expand, and fund programs that serve the needs of Latino communities, with, again, the focus on work, food, and shelter. And I wanted to share with you here some top line demographic data, and then I'll dig into the Connecticut specific data, which you'll see that there are some differences that are worth noting. But overall, 85% of the Spanish language survey takers identify as women. Overall, 79% of all survey takers identify as women. Nearly 70% of all survey takers identify as head of household. And nearly 3/4 of the Spanish language survey takers reported making less than $45,000 a year. And that was nearly 60% of overall survey takers. And we found that 75% had identified as employed, self-employed, or business owner pre-pandemic, and nearly 80% of Spanish language survey takers reported a reduced income. Over 70% of all respondents reported losing income, and 50% lost their jobs. Over 1/4 of participants identify as an essential worker, with positions ranging from hand sanitizer factory workers to home health aides, supermarket cashiers, food service providers, farm workers, nurses, and law enforcement. 87% of Spanish language survey takers reported using savings to cover basic costs versus 65% of English language survey takers. Overall, 76% of all respondents had to use savings. And finally, nearly 1/3 of respondents have not been able to pay their rent or mortgage, a total of 43% among Spanish language survey takers versus 20% English language takers. So now I'll take a moment to dig in a little deeper to the Connecticut specific findings. As you can see, the large majority, almost all survey takers for the Spanish survey identify as women, and overall 85%. 76 of the Spanish language survey takers identify as head of household. 72% of all survey takers identified as such. And similarly to the previous top line findings, 83% of Spanish language survey takers reported making less than $45,000, and overall 68% of all the surveyed that make less than this amount. And with here you'll see most notably the essential workers. Nearly 40% of the English language survey takers identify as essential workers, compared to 32% of overall survey, and then 91% of Spanish language survey takers reporting using savings to cover basic costs versus 78% of the English language takers. And of course, over 41% of Spanish language respondents that have not been able to pay their rent or mortgage, compared to 32% of national survey takers. So, again, the numbers, they're similar in some areas, but in majority, as you can see, there are some discrepancies when it came to the Connecticut specific findings. So with that, we were able to take that information from the surveys and also have these conversations with our focus groups to really dig in deeper into, what we actually, we're hearing from the organizations. How have they had to go from panic to pivot when it came to their programming, right? Because of course, there's the overall need of the community, but then especially the needs for the organizations to be able to respond to the needs of the community, and also the new needs that came up. So organizations that maybe before did not do hunger relief, maybe they focused on workforce development, for example, realized, no, people need food. So they were, they had to pivot and do that. And also, as we are all here now, on Zoom, learning how to also increase our digital skills to be able to carry out programs and services to help the community. But with regards to some of the program and policy recommendations that came up to address the pandemic's disproportionate economic impact on Latino workers and provide equitable assistance to those hardest hit by the pandemic, federal, state, and local government must expand and better target relief assistance. This means prioritizing lower income communities, expanding emergency cash assistance through community-based organizations that can reach Latinos most in need, and monitoring the expanded payroll protection program to ensure funding gets to smaller and minority-owned businesses. Worker rights and protections should be enhanced to guarantee safety protocols for all workers, especially agricultural workers, inform workers about their rights, ensure worker benefits for employees who fall ill with COVID-19, and provide equitable pay, especially for essential workers. And also to provide Latino workers and small businesses equitable access to available assistance and services, government agencies should offer bilingual information about programs, application assistance, and culturally competent services. In addition, a wide range of job creation and training efforts are needed from immediate community hiring measures to longer-term job creation and training investments, universal access to childcare, financial education, and services for individuals and families. With regards to food, to increase food security for Latino households, the U.S. must systematically address both immediate needs and the historical inequities that have long caused Latinos to suffer from hunger at disproportionately high rates. So the recommendation is that local, state, and federal government expand, improve, and better target food-related assistance. This includes expanding access to free breakfast and lunch for children who are out of school, increasing food delivery, including to those who must isolate due to COVID-19 infection or exposure, and ensuring that food provided is nutritious so it does not exacerbate diseases such as diabetes and childhood obesity. The federal government should expand access to SNAP. We include that because since we had Puerto Rico as part of the focus, and once and for all, as the Biden administration is working to do, the public charge policy that has forced so many struggling immigrant families to forego assistance available to them. Our federal government should also forbid immigration enforcement from targeting people visiting food pantries and other assistance sites. Community-based organizations providing hunger relief services should receive increased support and become part of a food access pipeline between local growers and hard-hit communities. And with regards to shelter, there's a great need to expand and extend protections against evictions and foreclosures, while also protecting landlords who are providing affordable housing. Specific recommendations from the focus group participants across all regions included extending eviction moratoriums, suspending rent and mortgage payments, and expanding the application window for rent relief assistance with streamlined rules and processes. Also needed is targeted outreach and education addressing available assistance, tenant rights, and housing counseling services. There are also long-term solutions that are necessary, including policies that will ensure safe housing for agricultural workers, expand shelter options, and ensure safe conditions within shelters, increase affordable housing stock, and provide education and resources to increase home ownership. I know I shared a lot right now. Of course, the report is available to dig in a little deeper, but I'm going to pass the mic to Ingrid, who will go in a little deeper with the cross-cutting recommendations from the report.
Gracias, Diana. So while you click onto the next slide for me. Thank you. ¿Están conmigo? Right? It's a lot. So if you just bear with us a few more minutes, these are critically important policy recommendations. Many of them, pre-COVID, part of our, commitment to advocating on behalf of communities, and now just exacerbated by this health crisis. And so what I'm going to do is that I'm going to move what I call the Brady Bunch box down with all the pictures so that I can be able to present to you now cross-cutting program and policy recommendations. And while the focus of the report was to do a deep dive on economic empowerment, the social determinants of economic security and health are like a DNA strand, and they're so tightly intertwined and integrated that we cannot talk about food, shelter, and work without integrating cross-cutting program and policy recommendations. And to start, honoring the central role of Latino and BIPOC nonprofit sector. They have held the line. They are the first line of responders in our community and continue to be, and they greatly increase, and the recommendation is to greatly increase the funding and the official involvement of the Latino CBO sector as providers of emergency assistance, outreach, and ongoing education and services. Puerto Rico and parity, both economic inclusion and fiscal parity, are a top priority. And that's to create and enact public policies that close the rising racial and wealth gap and opportunity gaps, and stimulate sustainable economic growth and begin to make permanent the American Rescue Plan's expanded earned income tax credit and child tax credit to our brothers and our sisters on the island, because there are very stark and disparate conditions between what a U.S. citizen on the island versus a U.S. citizen on the mainland is able to access. But ITINs for our undocumented brothers and sisters, and honoring that rather than requiring social security numbers for both emergency and recovery aid. Under immigration, access to services, right? Provide full access to emergency relief and recovery assistance for undocumented people and mixed status children and families in this and future crises. Immigration reform ensure protections and provide pathways to citizenship for DACA participants, undocumented people, asylees, and refugees. Let's honor the laws that are in our books, right? And let's start working on fixing our broken immigration system that doesn't serve anyone in this country. Under public health, ensure the availability, accessibility, and affordability of healthcare and prevention services for all U.S. residents, which includes increasing federal funds for nonprofit community health providers with a focus on those that serve the most vulnerable and making permanent the increases in the Affordable Care Act, the ACA, premium subsidies for low-income people. Go on my next slide, thank you. Let's recognize and address transportation issues that limit access to services and opportunity, both to provide immediate access to pandemic relief and to address long-term inequities and access to safe and efficient public transportation. Let's bridge the digital divide, provide robust, linguistically appropriate communications and assistance to the Latino community during the pandemic, and this includes bilingual information and hands-on assistance to help eligible Latinos obtain benefits and services, and arrangements that allow people without smartphones or internet access to apply for services and make testing and vaccine appointments by telephone. Make culturally and linguistically appropriate physical and mental health services more available and affordable, including initiatives to address domestic violence and child abuse, which are made worse by economic and health stressors. This concludes the presentation. I highly encourage, and I do know that our friends at the Latino Endowment Fund has forwarded in advance the report. The report is a much deeper overview of all of these recommendations. At this juncture, I would really encourage and invite the audience this evening to take a poll. And the poll will come up shortly. Just stay tuned on your screen. And as the poll question is coming up, we'd like to ask you, we are now more than 18 months into this pandemic. It has impacted so many communities, but none as hard as the Latino population, which continues to have the highest rate of cases of any other ethnic group. In your opinion, what are your top 3 most pressing needs in your community? We facilitated some answers, and we invite you to participate in responding. We'll keep the poll open and share the results of the poll with each and every single one of you before we move on to the next juncture of our program. All right, we're going to share the results. And right now, it looks like that consistent and in alignment to our presentation this evening, access to affordable housing at 36%, closely followed by access to quality employment, followed by food insecurity and that continuous need, or people are hungry still, facing, if not already, experiencing homelessness, haven't been able to recoup lost wages and loss of employment. And then let's couple that with the stressors and the impact on our small business community on each and every single one of our main streets. And vaccine access. Just because something is made accessible doesn't mean that it is available to all of us where we live. And so thank you for participating this evening in this poll. You validated for us the recommendations on the report. I'm going to now pass it over to our moderator. Before I do so, I just wanted to thank my colleague Diana for joining me this evening and wish her safe travels. And Rosada, take it away.
Thank you, Ingrid, and sharing with us that fabulous report and for giving us some great statistics, not only at the national level, but also at the Connecticut level. I'm really kind of taken aback by the number of people who responded to the survey questions that were female, which only goes to show that once again we are holding down the fort and having to deal with this horrendous pandemic and all the aftermath of it. And it's interesting that today's panelists, as well as our keynote presenters, are also all women. So we've got this, ladies. I want to introduce to you now our three panelists, and I'm going to go deeper into each one of them in a second, but they're Francis Padilla from the Universal Healthcare Foundation, Moraima Gutierrez from the U.S. Small Business Administration, and Superintendent Leslie Torres Rodriguez from the Hartford Public Schools. I want to talk first about Francis because she's going to be our first panelist up. So Francis, as I said before, is the president of the Universal Healthcare Foundation of Connecticut. And since joining Universal in 2004, Francis has held various leadership positions and was named to the leadership role of president in 2012. Among her contributions over the years, Francis spearheaded Universal's research and policy initiatives, leading to the design and campaign for the landmark Sustanet Health Reform Plan in 2009 and 2011. She masterminded the development of the Connecticut Healthcare Affordability Index, a first-in-the-nation policy analysis tool for assessing how public policies can best address healthcare affordability needs of consumers. And most recently, Francis is leading Universal and other organizations and funders in strengthening the capacity and infrastructure of community organizing for social and health justice in Connecticut over the next 5 years. I'm going to say that probably one of her best things is that she's a Wesleyan graduate, because I'm a fellow Wesleyan graduate, but also she happened to have started her career in philanthropy with the Hartford Foundation for Public Giving. Her bio is quite lengthy. I'm going to leave it at that. She is fabulous. I introduce to you my colleague, my friend, Francis Padilla.
Well, thank you. Thank you, Rosaida. It's an honor and a pleasure to be here with you all this evening. This is a really important program. And as the Latino Endowment Fund and your sister fund at the Community Foundation for Greater New Haven, the Progreso Latino Fund, really we are partners in lifting up the voice of Latino philanthropy in this state and addressing the issues that are most critical to our communities. So I'm not going to use slides. I am going to use a few more data points, though, to really put points of emphasis on the findings that Ingrid and Diana reported from the Hispanic Federation survey. And I'm so delighted, Ingrid, so glad that the Hispanic Federation has done this seminal body of work. It is so critical. We have work to do at the state level. We have work to do at the national level. And we are really quite fortunate to have the Hispanic Federation in partnership. So I'm going to start by saying what we all know. Many members of Connecticut's Latino community suffer silently. Yes to the Hispanic Federation's findings. We also know from another recent study of community well-being in Connecticut done by Data Haven, that 17% of Latinos did not get medical care during the last year and a half, compared to 9% of Black people and 10% of white people. We know that Hispanics in Connecticut, according to the health insurance exchange called Access Health CT, which is what the agency that administers the Affordable Care Act here, Hispanics in Connecticut are almost 4 times more likely to be uninsured than non-Hispanic whites. Blacks are 3 times more likely than whites. Blacks and Hispanics have also lost health insurance coverage at a greater rate during the pandemic. And this is, again, to reemphasize the point, a continuation of pre-COVID trends. Before COVID, 18% of Hispanics and 11% of Blacks were uninsured during 2018, compared to only 8% of whites. That's here in Connecticut, a continuing trend. Even with insurance, whether folks have insurance through their employers or buy it on their own, Latinos are more than twice as likely as others to have trouble paying for prescriptions. Asthma affects a quarter of Latino adults, who also have higher rates than the general population of diabetes and hypertension. Smoking rates are higher among Latinos and Blacks than the rest of the population, and 30% of Latinos are not vaccinated versus 13% of white people in Connecticut. So it is definitely a picture of disparity that I'm sure does not surprise anybody in our audience today. The executive orders issued by the governor last year allowed access to free testing and treatment during the period of the public health emergency. And despite this, access to care was still an issue. One of the most striking examples is the vaccination policy of prioritizing people over 70 for the first wave of vaccines. In Hartford, for example, that had the result of residents of suburban towns getting their vaccines at clinics in Hartford, while the majority of Hartford residents, predominantly younger than 70, had to wait months until their age group came up. This policy ran counter to the recommendations of advocates and others for an equity approach to vaccination. In talking about the economic impact, 36% of Latinos struggle with financial insecurity versus 20% of white people, 39% of Black people. 24% of the adult working population lost a job or were laid off, including 37% of Latino adults. That's almost 4 in 10 people who identify as Latino lost their employment during the pandemic. Precarious employment, which is the kind of employment that is part-time, temporary, very variable schedules, that kind of employment, 20% of Latinos are in that type of employment, underemployed, 18% of Black people and 11% of white people in Connecticut. The fact that there's food insecurity and housing insecurity are reflections. That fact is a reflection of the financial insecurity that exists. And these are intersectional issues. I think that that's really an important point to make and to reemphasize. Affordability in our state for healthcare is a real problem. There is Healthcare costs here in Connecticut are the third highest cost of a Connecticut family's household budget after housing and childcare. Worry about losing coverage is significant. Even people who have insurance, as well as people on the state's Medicaid program, which we know as Husky here, worry about losing their coverage and about being unable to afford the cost of premiums, deductibles, copays, and prescriptions. There is a need to detach health insurance from employment. That is an important part of the policy recommendations that need to be moved forward. You shouldn't lose your coverage just because you lose your job. Many people didn't have coverage to start with because they couldn't afford it, even if their employer offered it, right? So high deductible health plans, a lot of people can't afford to use them because they don't have the money to pay the deductible. Some employers offered to pay COBRA for a limited time, which was fine, but a very expensive option, both for the employer and the employee, and unsustainable. So healthcare is affordable in Connecticut if a family can reliably secure it to maintain good health and treat illnesses and injuries when they occur without sacrificing the ability to meet all other basic needs, including housing, food, transportation, childcare, taxes, and personal expenses, or without sinking into debilitating debt. Yes, better paying jobs are critical to the community's development and thriving families. But healthcare prices also need attention. The cost of hospital care, specialty care, prescription drugs, and health insurance must be reined in. That is a really important policy imperative. There's no way that families and their employers can keep up with healthcare inflation. It is off the charts. Imagine what families could do with disposable income freed up from healthcare by being able to buy a home, pay a mortgage instead of rent, or save money for their children's college education. These are two strong indicators of family intergenerational wealth that our people, Latinos, earning $45,000 a year and trying to make it, right? And trying to afford healthcare, don't have access to. And for Latino small businesses, for small businesses and nonprofit organizations, healthcare can be an absolutely debilitating expense. And so having healthcare that is much more affordable is also a business imperative. I want to talk for another couple of minutes about the undocumented, because that's another population that really the pandemic shined a light on in a very dramatic way. So according to the Migration Policy Institute, in Connecticut specifically, there are roughly 116,000 undocumented immigrants. 52% of them are uninsured. Half are uninsured. They come principally 37% from Mexico and Central America, 25% from South America, 11% from the Caribbean, another 11% from Europe and Canada, 13% from Asia, and 2% from Africa. So a lot of the undocumented in our state are Latinos. That's my main point. And as far as taxes paid by undocumented immigrants, a report from the Institute on Taxation and Economic Policy indicates a couple of key facts. Undocumented immigrants contributed an estimated $11.74 billion in state and local taxes annually. And in Connecticut, undocumented immigrants contribute an estimated $124.7 million in state and local taxes annually. So I raise that because undocumented immigrants are not eligible for the very programs that they contribute to, like Husky, even if they meet income guidelines. Those with legal residency must wait 5 years before they can buy insurance through the Affordable Care Act, through Access health CT before, even if they qualify for premium subsidies. People are paying taxes into programs that they cannot benefit from. And a great many of these people are Latinos who live under the radar, while they also provide essential services to the rest of us, such as grocery store clerks and delivery people, nail technicians, construction day laborers, home health aides. These are people that cross our paths every day. This year, a coalition of immigrant rights organizations and allies, including Universal Healthcare Foundation, advocated for eligibility for all undocumented for Husky. We succeeded in getting coverage for children from birth to age 8 and for pregnant women up to and including 1 year after birth. That covers a fraction of the 52% of people who walk among us as uninsured and disconnected from the healthcare system. That has to be corrected. Everybody who qualifies ought to be able to get the coverage. So I'm going to close with a point about power. Philanthropy has the opportunity and the responsibility to invest in building power to make change. It won't happen on its own. The forces of inertia in healthcare and every other social justice area are more powerful than the people affected by those problems. The power of those affected has to be mobilized. And that won't happen if philanthropy doesn't play a role. Dolores Huerta, the Mexican-American labor activist, founder and leader of the Dolores Huerta Foundation, was quoted as saying, "Every moment is an organizing opportunity. Every person a potential activist, every minute a chance to change the world." We at Universal have taken this imperative to heart and have redoubled our commitment to working in collaboration with other social justice movements to build power at the grassroots level, to build alliances across race, ethnicity, and geography, and common ground on an agenda for justice in Connecticut. One that we can collectively and systematically pursue over the next 5 to 10 years. And we invite everybody here to join. Thank you.
Thank you so much, Frances. You've left me with like 10 million questions and 50 things that I have to put on my agenda of things I have to start doing more of tomorrow. But I do want to underscore just, there's so many points to underscore, but one point that I really thought really hit me was the intersectionality of all the issues the Latino community is facing right now as a result of COVID. And the fact that it all stems from structural racism and ethnocentrism, which is really, all about power and is really about, being able to mobilize not only our community, but also our allies to really change what's happening in our country. So thank you so much, Frances, for that. Our next speaker is Moraima Gutierrez, and she is the Assistant District Director for the Economic Development at the United States Small Business Administration for the Connecticut District Office. In this role, she is responsible for further strengthening and delivering small business SBA's many programs and services throughout the state of Connecticut. Formerly, she was the station manager for Telemundo, WRDM, Hartford, where she was responsible for all aspects of managing the station throughout Hartford, New Haven County, as well as Western Massachusetts. She has an extensive background in marketing, sales, and general management in both the private as well as in government sector. And prior to this, she worked for the Latino and Puerto Rican Affairs Commission, where she was responsible for all facets concerning the media as the public relations liaison. She is a graduate of our very own University of St. Joseph's with an MS in management and a BS in communications liberal arts from Bay Path University. And she's also, I'm going to claim her as well, because not only is she originally from Danbury, Connecticut, so she's a Connecticut girl, but she resides in West Hartford, and she was formerly the chair of the Latino Endowment Fund. So thank you very much, friend, for being a part of this today.
Thank you. Thank you for the invite. It's always a pleasure. I mean, when I opened up my my Zoom screen and saw, you know, the Brady Bunch here, the squares of such amazing. I mean, I have to call you all Wonder Women, because you're all just doing so many great things in our state. And when we have sessions such as these, they're so informative, they're so educational, and they really, really give us a lot of, I would say, food for thought, right? We leave these meetings with so much information and so much, you know, what we call ganas de trabajar más fuerte, because we know that our community is counting on us. So the responsibility on our shoulders is heavy, the weight, right? But we carry it, and we carry it with pride. So I just wanted to talk a little bit about, again, we're talking about the economic impacts of COVID. And I mean, it has affected our community in just about every single sector. And, you know, prior to the pandemic, you know, we can still boast by saying that Latino-owned businesses, we know that we play an important role in our United States economy. We are contributors. We are, you know, we are spenders. We are really good consumers, right? We were the fastest growing small businesses. Latinos were the fastest growing in the ecosystem. The number of Latino-owned businesses in the last decade has grown over 34% compared to just 1% for other small businesses. And much of the growth in the number of these new businesses among Latinos has been driven by women, by Latinas. Not surprising, right? 40% of all Latino business owners, and the number of Latina-led employer firms has also grown 20% in the last 5 years. So Latina-owned businesses were actually moving in a positive direction before the pandemic. And once 2020 hit, the pandemic disproportionately impacted women at a much, much higher rate than it did men. And again, Latinas specifically, we hold a lot of weight on our shoulders. So when it came to small businesses, we were the first ones down. Only 1 in about 10 Latina-owned businesses actually had enough cash on hand to survive beyond the 6 months, compared to 2 in 10 Latino-owned businesses. And that's a lot, especially knowing that we carry the weight, a lot of us carry the weight of being head of households in our family. So again, a lot of this, it came, you know, we twice as many Latina-led companies experienced closure due to the pandemic. That's 30% versus 16. Missed scheduled payments such as rent, utilities, and payroll at twice the rate, 13% versus 7%. And taken together, this is going to take Latinas a longer time to recover. Okay, so again, women were the most negatively impacted by the pandemic, but for Latino-owned businesses, it affected Latinas more. And so in the initial wave of financial relief that came through what we called the Paycheck Protection Program, again, it was not that easily accessible, because the initial wave of what we call the PPP was only dispersed through national banks. And so national banks were the only ones authorized to disperse this funding for our small business owners. So our research shows that Latinos were not as successful in obtaining funding from the national banks because you had to, first of all, most of them, you had to have an account in that bank already established to be able to apply. So that was one of the largest hurdles for a lot of our small business owners to process. So one of the things that came later, fortunately, that came later for Latino small businesses, is that in the second wave of PPP, the list of approved lenders grew, and it included what we call CDFIs, which are Community Development Financial Institutions. And so at this point, then Latinos received greater success in receiving PPP loans. But one of the things that we have to remember was that the PPP was initially meant to keep folks on the payroll. It was not to avoid the massive unemployment. It was not meant for cash flow or for other small business uses. So again, this contributed to the large portion of the whole closing of small businesses during the pandemic. So we faced greater challenges in weathering the pandemic due to access of relief loans and a higher proportion of businesses and industry, particularly affected by the pandemic. Those are accommodation and food services and other services as well, were the first ones we would say that would have to close. One of the researches that I did, according to Yelp, the local economic report stated that temporary closures for our Latino small businesses then became permanent closures, particularly within the restaurant industry. And so in April of 2021, the number of active Latino business owners across all industries fell 32%. And by June 1st, 1 in 4 Latino-owned businesses experienced closure. And so it's very, very sad. So when we think about, the resources that were available to our small business owners early on through federal relief programs, a lot of them could not access the funding. And when the federal funds were first released, again, there was a lot of rules and regulations in order to be able to apply. So for small business owners in general, if you're going to access federal funding, you have to be in good standing with the federal government. So one of the things that folks don't think about is that, for example, if you're in arrears and you have outstanding child support payments and you don't have any type of payment plan, in the books with federal government, you cannot access any of these funds. And so, when we talk about barriers as well, if for a lot of these small business owners that maybe were behind in even filling out their 2019 tax returns, again, you don't have enough credible evidence to even show that you're in business because you can't even show something as simple as a tax return. And so again, we need to think about how we can meet our small businesses where they are. We need to think about how we can create a friendly small business ecosystem for our small business owners so that we can keep them in business, we can help them thrive, we can provide the networking resources, the leads, the access to capital that they need in order to be able to be at the same level as their white counterparts. So these are just some of the things that came out during the pandemic, and we are still in a pandemic. We are still in a pandemic. The federal government still has one of the last programs that is open now until December 31st is the Economic Injury Disaster Loan. And again, it's in the form of a loan and a lot of rules and regulations to go along with it. And, I have done extensive outreach. We are a small but mighty team in the state of Connecticut trying to do as much outreach as possible. I was on a webinar last night from 6 to 7:30. Again, all in Spanish, just talking about the economic injury disaster loan for small business owners, because we want them to know it's still there. It's, if you haven't applied, maybe this is the time. It's a 30-year term loan at 3.75%. And so rather than going to some, maybe, I don't know, the loan shark right in your community, that's going to give you an astronomical interest rate of maybe 30%, how about, looking at a program like this, that's a 30-year term loan with a 2-year deferment. And so we want our small business owners to know that perhaps that the mistakes that were made early on, just because it was a pandemic. And I think that things were just kind of being thrown out there. And a lot of these nuances were not taken into consideration. These are things that we want small business owners to know, that the programs are out there. If they are accessible to you, we want to be able to, be the guide and the roadmap to show you how to have access to these resources so that you can, compete in this business ecosystem here in our state of Connecticut. So these are, some of the things that come up. And again, we will continue the dialogue because this is very, very interesting. And we know that our Latino community, the majority of, I know that, my family comes from a strong line of entrepreneurs. El que no tiene una bodega, tiene un restaurante, or does something, that has to do with small business, whether they're operating out of their home or whether, they have a brick and mortar. But these are things that are very, very important to our community. Having to be able to achieve the American dream by becoming an entrepreneur. So we want to make sure that we keep them healthy, that we keep them thriving, and that we have that strong business ecosystem to keep them there. Thank you, Rosaida.
Thank you so much, Moraima. It strikes me as a small business owner myself, how, so many of us, have really struggled through this whole situation. And I am very proud of the Latino Endowment Fund's partnership with the Hispanic Federation for many reasons, but we are about to launch a new program, which we just gave a grant to in collaboration with SAMA. Actually, SAMA is our grantee, to hopefully help some of these small businesses in Hartford be able to understand the programs and the dollars that are available to them and to be able to begin to access it more effectively. So I'm really, really very glad of that. And I'm so glad that you've shared that information with us. It just affirms what we're doing. We're doing something right, right?
We're trying.
We're trying.
We're trying.
Thank you so much, Moraima. I want to now introduce to a woman who in our community doesn't need much of an introduction because she's our superintendent, our wonderful superintendent, Leslie Torres Rodriguez, who is the superintendent of one of the largest urban school districts in Connecticut. And she is a product of Hartford. She's a homegrown girl and a product of Hartford Public High School. And she has served as an educational leader in Greater Hartford for over 26 years. Prior to her appointment as the superintendent, Dr. Torres Rodriguez was acting superintendent and the assistant superintendent for instructional leadership within the Hartford Public Schools, where she provided culturally courageous leadership in support of comprehensive improvement efforts. Dr. Torres Rodriguez also taught social and behavioral science at Capital Community College and served students and families at Goodwin Technical High School as a school social worker. Dr. Torres Rodriguez received a Bachelor of Science in Human Development and a Master of Social Work from the University of Connecticut, and she earned a doctorate in educational leadership from Central Connecticut State University. She's received many accolades. Most recently, she was the recipient of the 2019 Connecticut Association of Latino Administrators and Superintendents, the Calas Award for Educational Leadership. Thank you so much for joining us, Leslie. And we want to hear from you. How are our kids doing?
Thank you for the introduction and of course the invitation. Buenas tardes a todos. And I think, as I'm going to share some key headlines as to what we learned and what we are actually stepping into this school year, and how what we heard from the panelists, what I gleaned from the report, how all of those things are actually manifesting in some of our classrooms, which is actually a point of concern that I have and that we should all be sharing. So I'll kind of start with some key headlines in terms of what we learned, right? First of all, we know that our students and our communities have longstanding needs that, of course, the pandemic, has exacerbated. Existing gaps, however, deepened, and a new gap emerged for us with regard to students that were learning in person and remote learners. And it was a challenge for us to provide both remote and in-person instruction for most of the year last year. And our data showed that remote learning, just didn't reach all students. And I do believe that it will take us years to truly understand the full impact of the pandemic on student learning, on social and emotional behaviors and skills. But we're getting an early sense of that because, well, we did prioritize in-person learning last year, yet a large portion of our students still experience remote learning. It was what the majority of our families, 59% of our families, elected to have last year. And another key headline for us is that even after making progress addressing student chronic absenteeism, I mean, it was something that as a community, as a broader community, we all rallied and wrapped our arms around this challenge. We made great progress, and the pandemic and remote learning, right, exacerbated the attendance challenges. We saw 48% chronic absenteeism rate last year. Just to give you a background on the definition of chronic absenteeism, right? It's when a student misses 10% or more of the average the entire school year. And another key finding for us and trend is that, which was expected, right? The pandemic interrupted student learning progress. Learning challenges were most significant for our remote learners and those that are historically marginalized student groups across the board, in literacy, in reading, and in math. And, you know, we begin to unpack all of this, and we see that our Latino community, you know, now is faced with these wider gaps. And just to give you some context as to who we currently are serving in Hartford Public Schools, our Hispanic Latino students are the largest ethnic group in our district, right? So we have about 17,200 students, and 56% are Hispanic and Latino. And when we look at the data or our demographics in terms of subgroups, which tend to be groups of students that have a higher level, deeper level of need, we see that with regard to our students with disabilities, students that have learning exceptionalities and require additional supports, you know, we have 20% of our student population are students that are students with disabilities. But when we narrow in of those 3,400 students, 2,300 of them are Latino, right? So we have a higher level of need there. We go deeper into our demographics, and we see that with regard to our multilingual learners, right? For those of you that don't know, you know, before the term was English learners, that is now shifting to multilingual learners. And overall, out of those 17,000 students, 22%, or almost 4,000 students, are multilingual learners. The majority of those are Spanish-speaking students, students that are learning English, Spanish-speaking students, natives, that are learning English as their second language. And then we have our students with unstable housing. We learned, right, as we heard, we saw in the report, and we heard from some of the other data points that were shared, when we look at our students, we have 120 students that are, you know, that currently are living in unstable housing situations, and the majority of them are Latino as well. So, right, this backdrop, then you overlay the impact of the pandemic, and we have, right, a deeper exacerbated need for Latino students. The one area that for us, you know, that we continue to try to problem solve, and we know that we need broader support around, continues to be the chronic absenteeism piece. Right, our Hispanic Latino students have the highest rate of chronic absenteeism, even today, currently. And we know that chronic absenteeism is linked to lower student achievement and even, you know, graduation rates. And when we were unpacking these data trends, even before the pandemic, we saw two key challenging points when you think about the continuum from kindergarten all the way to 12th grade. We saw that kinder and first grade were among the grades that had the highest level of chronic absenteeism across all groups, but for Latino and Hispanic students, it was a higher rate. And so that means that The 5-year-old can't get to school on their own, right? So we know that that requires a broader support strategy, right? We know that that perhaps is a familial barrier that is at play, right? Families might need additional supports. We also saw higher chronic absenteeism rates during the transition years from 8th to 9th grade, which means that we need to do a better job locally in the school district, but with our community partners to support students as they transition to high school. And as I think about the impact of the pandemic on proficiency, academic outcomes, and even graduation, with regard to literacy, reading proficiency, for all students, it is a major area of focus and concern, especially for our Latino students. We also see it in math. Only 8%, for example, of our 8th grade Latino students were proficient in math last year when we did our assessment testing. And we know that when we unpack our data with regard to graduation, graduating on time, meaning students graduate within their 4 years of high school, we also see that our Hispanic students are less likely than their peers to graduate within those 4 years. And lastly, when we dug into our data with regard to post-high school, post-secondary experiences, we also see that our Hispanic students are less likely than their peers to enroll in college following high school. And we certainly saw that as a trend last year. We heard from some of our students, our Hispanic students, that they had to take on jobs last year to support their families, right? And that for those of us that have been in that situation during our youth, it's really hard when we have these competing demands. And, oftentimes, right, our families win out. The commitment that we have to supporting our family wins out. And so we heard that from some of our students that they're now asking us for opportunities to innovate in terms of how they're going to learn and when they're going to learn. We did have some specific programs focused on supporting our Latino students that we were able to sustain through the pandemic and are now looking at how do we scale those. One is our Dual Language Academy, which we actually launched in September of 2020, which is a 50-50, two-teacher model where students, learn half of the content, the curriculum in Spanish, and then the 50% of the remaining time they learn it in English. And that has been a successful model that we hear our families actually require, asking for more of those models. The other model that we want to make sure that we continue to leverage is the Seal of Biliteracy, which supports college and career readiness for students. And it is a prestigious award given to students that demonstrate proficiency in 2 or more languages by the time that they graduate. And, it's something that goes on a diploma and is acknowledged by colleges and universities. And, even through the pandemic, last year was the year with the record seals, the record number of seals earned by our students, right? 128 seals were awarded. And we also have our Student Success Center at Hartford Public High School, which really is focused on supporting our students that lack the necessary credits to graduate on time. And again, throughout the pandemic, we realized that this became a godsend, if you will, for students, which is what we heard directly from our students. And we were able to graduate an additional 146 students, the majority of them Latinos, in August. And so students needed additional supports and extended learning times throughout the summer. So we have some, programs and supports that were already implemented that, were, as a result of that, we were able to keep some of our students engaged despite the challenges of the pandemic. As I reflect on the immediate needs and even begin to forecast out some of the needs, mental health, social, emotional supports, for students, for families, and for our staff. We are seeing that across many of our schools. Our students are showing up, and their trauma, their challenges, they're manifesting behaviorally. And I know that our teachers, our staff, our school leaders, our families, right, we are all managing through like multiple layers of obstacles, and the layers have thickened, right, with unprecedented staff shortages, right, that we across the state and across the nation are facing in education and in other fields. So as I think about immediate needs, staffing shortages, and coupling that with culturally responsive instruction and also supports for our students. I heard, I read in the report with regard to the need for integration of supports. I believe, in the need in having an integrated ecosystem of supports for students and their families. And that's really hard work to do. And so I know that it requires not only us in the school system, but others, locally, and even perhaps at the state level, to come together and prioritize, the responses in the larger ecosystem. The other immediate need is around year-round acceleration, right? We know that learning was interrupted. We see the gaps, and we know that there are research-based strategies that work. One is, a high dosage, 1-to-1 or 1-to-2 tutorial supports. That requires additional time, right? Extended learning days, extended learning opportunities, which we are responding to with after-school programming. Intersession is the first time in Hartford Public Schools that we'll offer supports and learning opportunities for students during our breaks, our vacations, and then of course throughout the summer as well.
Thank you so much. I'm going to have to cut you off because we're running really behind schedule.
You got it.
But I do want to say that, what you've shared with us is just so troubling, because I felt that just right before the pandemic hit us, we seem to be making a different trend. We seem to be improving in many areas, and that then the pandemic just stopped everything from the positive trend that was going. So I do want to take a couple of questions. I am going to shorten the Q&A, however, because we are a little bit behind schedule, but there have been a couple of questions that have come our way, and I want to make sure that we address at least one or two. So the first one is this question about undocumented or documented immigrants. And a lot of folks always ask, well, why should we be even concerned about the undocumented? How could we want to include undocumented immigrants in public coverage programs like Huskies when they're not documented, they're not residents, they're not citizens? Why should we care? And I think this is a really important question that we need to be able to answer, because I hear it all the time. So Frances, can you please help us with that?
Yes, definitely. It's we pay one way or we pay another, because we're talking about undocumented residents of our state are human beings. They are members of families, they are parents, they are grandparents, they are young people. And when they have to defer care and ignore a pain or ignore a lump or go unattended when they have an accident, that adds up to worse and worse health outcomes. And they end up in emergency rooms quite often if they don't actually die, all right? They end up in emergency rooms, which is the most expensive form of care and the most inefficient form of care. And so that is one reason that we really do need for everyone to have coverage, every undocumented person to have coverage. And I gave those data points about the taxes that people pay into our system to also emphasize that 52% of that population of the 116,000 are uninsured, which means that 48% are insured, which tells you that not everybody in the undocumented community is here in this country unable. Healthcare is too expensive for everybody, especially, if you're working on limited income, but there are people that are actually getting their coverage some way, somehow. And the key is that this is public health, particularly in the context of a pandemic. We need to have everyone attached to the healthcare system. Everyone should have a primary care doctor. Everyone should be able. And so the argument for me is, it's, if not a sense of altruism or caring, it's enlightened self-interest.
I couldn't agree more. I really couldn't agree more. I always have been struck by, the teachings in my family and in our church of, you are your brother's keeper. And I always think of when people ask me these questions of why should we bother helping someone, or why should we bother, pushing for healthcare coverage for the undocumented when they shouldn't be here anyway. It's just, I'm struck by it because I can't believe that we are actually that callous and that we don't recognize the fact that there before the act of God or the grace of God go I, and that what happens with folks who are in poverty and in dire need and undocumented in our country is only going to impact all of us, in a blink of an eye, just like COVID hit us in a blink of an eye.
If I could just add one more point, which is a lot of people live in mixed income households. There's a comment in the chat from Werner about that, which means that you could have, in a family of 5, 2 people could have coverage and 3 don't.
Exactly.
That is craziness. And also this public charge rule that the federal government passed during the Trump administration was really very discriminatory and racist, and intended to keep people who are immigrants from getting citizenship or getting legal residency based on how much they would use public services. And thankfully, the Biden administration has rescinded the public charge, but it has kept a lot of people from accessing because they're afraid, right? So even though it doesn't exist now, there's a lot of outreach needed and education needed to help people understand that they're not going to be reported, to ICE. We are in a moral dilemma in this country on that front.
I totally agree. I totally agree. And one last question, because I really need to push us, but the question before us is, what can we do here in the Latino community as members of the Latino Endowment Fund or not members of the Latino Endowment Fund? What can we do to address some of these policy issues that you've got a lot of policy recommendations, but we heard from Francis, we heard from Ingrid and Diana, we've heard from Marima and from Superintendent that there's a lot of things that need to change. What can we do? And I leave it open to any of you. Ingrid, would you like to respond to that?
Sure, and very simply get involved. And if you don't know how, then reach out tonight to any single one of us here. I actually, my hat off to you, all of you ladies, the superintendent, Moraima, for Francis. I dropped in the chat, I'm a healthcare voter. And I will disclose, as long as I've been in the role that I have been, it wasn't until I partnered and I was educated by the Universal Healthcare Foundation of Connecticut that I was centered in both the economic return on the investment when our people are healthy, when they're able to get coverage. And I share that because even as, someone like me or even Werner who's out in the audience, and many of us sort of may be considered as these novice advocates, or right, that there is always a space, there's always a table, there's always a friend, an hermano, an hermana in a fight that could use our voice. And we don't need to have all the tools on our belt and know it all. We just need to show up. And back to Francis's point, and thank you for bringing that up, back to the philanthropic sector. and our brothers and sisters there, right? We must invest in the empowerment and the power building of our people, where the rubber meets the road from the ground up. You know, as Latinos, we're the youngest, I believe the average age in Connecticut itself, 27 to 28 years old. That's also our undocumented brothers and sisters. And so our state's recovery, both, you know, pre and post pandemic, when we get to that point, is inextricably tied to who we are as Latinos in the state of Connecticut. And so again, get involved, show up, and someone will teach you, and we'll do it together.
Thank you, Ingrid. Thank you so much. And as our fearless leader and chair, Barbara says in her chat comment, you know, if you're not part of the solution, you are part of the problem. So true, Barbara. I'm going to set us up for the breakout groups now. I'm going to turn it over to my colleague, Diana, who has been waiting very patiently. We don't have enough time to really debrief it, but I'm handing it over, Diana.
Great. So through the magic of Zoom, we are going to automatically break you out into a group, and the facilitators for each group, I just put their names in the chat, so you will be able to identify who your facilitator is. And I'm sure they will introduce themselves to start. But what we really want to get out of this is your opportunity. Maybe you weren't a panelist, but this is your opportunity to tell us what are your areas of interest and or concerns that you personally want to join us on in tackling in the coming year. And then if we do another one of these webinars or in-person seminars, if we can all dream, have a vision board about that, what would you like to hear more about at an upcoming educational seminar? I just learned so much from listening to the three panelists, and I was taking so many notes about their priorities being on the front lines, which helps so much. So I want to call out and thank again our panelists. And then finally, we're all in very fortunate positions where we can give back at this point in our lives. And so how do we increase the membership and engagement in the Latino community in creating solutions for these opportunities in our community? So those are the three questions we'd like you to discuss. And as Rosida said, due to time limitations, we're not going to be able to have a debriefing, but we want each group to really talk about these questions so that we can then pull the data together. We'll email everybody back with a summary of what we learned from you all. But thank you for your thoughtful time and energy in your breakout group on these three questions.
Welcome back, everyone. As Diana said before, when she sent us all off to breakout rooms, I'm sorry we don't have the time this evening to debrief, but we promise to take note, to have those notes gathered from our facilitators and to send you a summary of some of the key findings. So thank you very much. I hope you enjoyed getting to speak to one another. Now it is my distinct pleasure to introduce to you our vice chair of the Latino Endowment Fund, who is, and Delpha, forgive me, but I always butcher your last name, Delpha De Giacomo.
You got it. Thank you.
All right.
You got it. Thank you so much. And I will tell you, I was one of the facilitators, and it was such a good conversation. And I'm sorry, it was only 10 minutes, but I know I walked away with a lot of good feedback from all of you. And I'm sure the rest of the breakout sessions work that way. So my job tonight is to kind of walk you through some of the thoughts that at least I took away from this, and I'll be super brief about it, and then tell you what are we doing in the Latino Endowment Fund moving forward. So what I heard was that the intersectionality of the issues and barriers that were presented today is real. Access to food, shelter, focused awareness, and access to education from children to small business owners in innovative ways that aligns with the needs of families and are culturally competent is a continuing area of growth, even beyond the pandemic, in our endeavor to move away from that panic mode to true pivoting and thriving. We heard early in the conversation how philanthropy has the power to create momentum and change in our community, and that is so true. So let me tell you how the Latino Endowment Fund is using its power to create change right here in the greater Hartford area. You may have noticed on the chat that there was a link shared to the grant opportunity available through the Latino Endowment Fund. This is a competitive grant opportunity that will offer up to $25,000 per grant to eligible nonprofits that can demonstrate specific benefit for the greater Hartford Latino community. Eligibility is restricted to organizations that serve Latino residents with the foundation, within the foundation's 29-town region. Now, we heard our members in the last year tell us where we should focus. So this year, we've identified two critical funding priorities to benefit the Latino community in Greater Hartford: advancing racial and social justice and promoting professional development in our community. Additionally, and Nora was in my group, Nora, I think you'll appreciate this, we know that small businesses are a critical component of growing, vibrant, and equitable communities. Today, you heard Moraima speak to the issues facing small businesses in our community, and I think that information was pretty valuable, especially the focus on women. In response to that situation, and as Rosida teased earlier tonight, the Latino Endowment Fund at the Hartford Foundation, alongside with the Hispanic Federation, are providing a $25,000 in grants to the Spanish American Merchants Association, SAMA, to launch the first phase of the Progreso pilot program to provide 10 greater Hartford Latino-owned businesses with capacity building and consultation support to improve their ability to access federal funding. Additionally, this program is going to seek to build the capacity of Latino business consultants by offering them the opportunity of work experience in this space, compensation, and professional development. And part of the issue is that we lack the existing bilingual and bicultural consultants with the experience necessary to support the businesses. So for us, this is a 2-for-1. So with all of this exciting work, and I promise you we have this robust strategic plan that we'll be launching later on this year, we ask that you join us on this journey. Become a member, become a volunteer, and if you're so inclined, consider joining us at the table by becoming a member of the steering committee in 2022. So that's my call to action. I hope you heard it, and I hope you feel empowered enough in the conversations that you had in breakout session to join us. So with that, I'll now hand over the virtual microphone to Jay Williams, who is the president of the Hartford Foundation for Public Giving, so that he can share his closing thoughts.
Before Jay comes on, I would like to introduce him.
Go ahead, I did, but you can have him too. We love Jay.
No, I did, he's too wonderful not to say a couple of words about him, right? I mean, not only is he a friend of the Latino Endowment Fund, but he is wonderful in our community. And he's been the president of the Hartford Foundation since 2017, and currently has led the foundation's commitment to dismantle structural racism, achieve equity, and improve social and economic mobility in our region in partnership with nonprofit organizations and community stakeholders. I have to tell you that I have been a part of the Hartford Foundation family now for well over 30 years. And it is the first time although the foundation has done wonderful, wonderful things, it is the first time it has really stood squarely in that area, really focusing not just money, but also influencing and power. So thank you so much for that, Jay. Prior to coming to the foundation, Jay served as the U.S. Assistant Secretary of Commerce for Economic Development, where he led the federal economic development agenda for the United States. He was also Deputy Director of the Office of Intergovernmental Affairs at the White House, where he was the principal liaison between the president and local elected officials. Previously, Jay also served as Executive Director of the Federal Office of Recovery for Auto Communities and Workers and he arrived in Washington, D.C. after serving as a mayor of the city of Youngstown. Thank you very much, Jay, for joining us.
Good evening. Thank you, Rosada and Delphi, for the introduction. And Rosada, I'm glad that you read an extended version of the bio, because I was all hot and bothered. You guys had me all flustered with the compliments, and I wasn't sure I was going to be able to compose myself. So thank you for the introduction. I'm happy to show up to any meeting you're having with an introduction like that. So even if I have no relevance there or no role, I'll just show up and then disappear.
Good for your ego. I know.
But thank you kindly. Really, we have enjoyed the relationship. I've been with the foundation now for four plus years and have enjoyed all that I have learned about the community, and particularly about the work and the efforts of the Latino Endowment Fund, and then the individuals that I've had a chance and an opportunity to meet over the past 4 years. So I know we're running short on time, but I do appreciate this opportunity just to bring together some finer points and thoughts. I've had an opportunity to hear a number of the speakers behind the background, and really just wanted to share with you a summary and a lot of what Rosada was just talking about. That the Hartford Foundation, while we've been around we're going on our 100th year in the year 2025, and great work has been done. I am so blessed to have come after a number of my predecessors who have led this organization, the staff members who have really helped to build goodwill into the community. And as a result of that, and the support of the board, and of course, without our donors, we could do nothing. We have been able over the past 2+ years to lean into our efforts and our work in anchoring ourselves along with our partners to helping to create and facilitate more inclusive pathways to prosperity, economic mobility, with a specific focus, a very specific and a pronounced and public focus on communities of color, even more specifically, the Hispanic, Latinx community, and the Black community, because we all know from our lived experiences that those communities have for far too long had great talent, but have not had the opportunity, have had the hardest and most creative entrepreneurs, but have not had access to capital. Have not been able to achieve, and I'm going to use this term generically, quote unquote, the American dream, that if you have a good idea and work hard enough, you can be as successful as anyone else. We know that there has always been a different set of rules that we have had to not abide by, but that we've had to suffer through as it relates to progressing in this country. That being said, we appreciate the fact that in doing that, there has been also a pronounced focus on our small businesses, particularly those small businesses owned by people of color. We know that those small businesses serve as a lifeline to neighborhoods, to residents. We know they employ people from the community. We know that they understand the plight of people in the community. So if it's extending credit, if it's providing opportunities for young people, we know that those small businesses are also the economic engine of our communities in our country. And too often those small businesses owned by individuals of color go unheralded. They do what is necessary to provide the goods and services that we all need and partake of, but they often do it at a distinct disadvantage. And that was no more evident than what we saw during the pandemic. And I know Mariama talked about this. The billions of dollars of federal aid from PPP and all the other federal programs that were rolled out with the intent to help small businesses. Once again, small businesses owned by people of color who would have otherwise been eligible for any number of reasons were not able to access those funds at the same rate of some of their non-community of color counterparts. And it wasn't because the businesses weren't eligible. It wasn't because the businesses weren't in need. There were just a whole host of structural and historic challenges that occurred. So we did a couple of things. We immediately worked with SAMA and HEDCO and the City of Hartford and Capital for Change to create a small business grant program, the third round of which has just closed, to provide grants of up to $10,000 for those businesses to not have to go through the rigmarole and all the hoops that were often associated with some of the federal programs, notwithstanding the fact that by the time they were able to access or get in line, many of those programs had dried up. But we also, for those businesses of color that were able to apply, we worked with local trusted technical assistance providers. So those businesses could tap into the federal program loan. So we saw it as a dual path, providing direct assistance through the grant program, which was a collaborative effort, as I talked about, but we also understood how important it was to provide the trusted technical assistance for those businesses that were able to apply. Another thing that I am so proud of, that we are so proud of, was the fact that we collaborated with the Dalio Philanthropy and the City of Hartford to initiate a citywide free Wi-Fi system. Hartford is one of the very, very, very few cities in the entire country that has broadband. That means the fast broadband speeds of internet accessibility that is being built across the entirety of the city, with a couple of those neighborhoods already up and running. And that's important because not only is it important for the individuals, families, and educational opportunities, and we heard Dr. Torres Rodriguez talk about that importance, but it's also important for small businesses, for them to be able to transact, to be able to provide for their customers. So that is an ongoing project. Over the next year or so, it will continue to be rolled out. But again, it's something to be proud of, that every resident and business, small business in the city of Hartford will have access to that citywide free Wi-Fi system. Something else that's important, and we've been having conversations with LEF, and we're excited about the paths that we're exploring, is the Hartford Foundation for many, many years has supported the Greater Hartford Wellbeing Index. And what that is, it's a database, and there's a lot of collaborative partners that really produce data that speaks to the quality of life, that speaks to the well-being indicators within various segments and components of the community. And while that is important, we have heard loud and clear, and we understand and completely agree that it's important that that information is disaggregated and is appropriately tailored, so we understand how the impact of COVID and so many other things are laying into the Hispanic and Latino community. So to that end, we're going to use the data that is already there, but we are exploring, I think this was already, hopefully it's already talked about. If not, I'm going to be in trouble. Exploring the pathways of how to collaborate with LEF and other players to really make sure that there is data that speaks specifically to the economic conditions, both the challenges and the opportunities in the Hispanic community, to have the qualitative and quantitative data that would be necessary and important to achieve the aspirational goals and the very laudable goals, and goals that we absolutely see as a partnership between us and LEF in achieving over the next number of years. So I will end there just by, again, thanking all of you for your passion, for your commitment, for everything that you have done and continue to do to increase the quality of life, to help us achieve our mission, which again is about creating vibrant communities across the Greater Hartford region. But our strategic focus has led us to understand that we can't do that with the inequities and the barriers and the structural systemic racism that has plagued this country and this community for far too long. And our success in doing that will only come about by way of the partnerships that we have seen and heard about, and that we continue to prepare for today. So thank you very much for everything. I would be remiss if, again, didn't thank the board, our donors, and very specifically tonight, the entire staff of the Hartford Foundation for Public Giving. You often see me out front, but know that I am prepared and equipped by a committed and talented and passionate staff. So Rosida, I throw it back to you.
Thank you so much, Jay, for your words, and also for your commitment to this community, and not being a homegrown boy. We know that, but we'll love you all the same.
Thank you.
And to our panelists, to our keynote speakers, thank you so much for your work, for your presentations, and for joining us today. And to our audience, thank you as well. And we hope to see you soon. And please join Latino Endowment Fund. We need you. We need more of you. We need you to be committed, as I know you are, to our continuing helping our community in Hartford. Thank you so much, and good night.